Good afternoon, everyone, and welcome back from our break and directly into session 3 of the workshop, Hematopoietic Stem Cell Transplant Survivorship. In this session, we will examine aspects of physical, cognitive, psychological, and psychosocial function after transplant in both adults and in children. And then we will talk about the interventions that can affect patient functioning and quality of life. This session brings together individuals with various perspectives. We have our clinicians, we have a patient, and we have a caregiver, each uniquely reflecting the range of outcomes and experiences following transplant. I am Margaret Bevins, a nurse and clinical researcher working at the National Heart, Lung, and Blood Institute at the National Institutes of Health in Bethesda, Maryland. I am pleased to moderate this session today because after almost 3 decades working with patients who have received stem cell transplant, it has never been more clear that for all of us trying to help a recipient and their family reach their full potential post-transplant, we must understand their whole story, including the perspective of the patient and those who are most affected by the patient's illness and their treatment. This morning, our speakers highlighted that hematopoietic stem cell transplant is a cure with a cost. The experts in this session are committed to rigorously understanding this cost and how we can provide supportive care to patients and their families to maximize their functional recovery. Our first speaker will be Karen Cirelia. She is a professor in the Clinical Research Division and professor in the Public Health Services Division at Fred Hutchinson Cancer Research Center, where she is also the Director of Behavioral Sciences. Dr. Cirelia will provide an overview of how we assess a patient's functional health and key findings about their level of function post-transplant. Speaking on the topic of best practices and interventions in stem cell transplant survivorship is Dr. Areej Al-Jawari. Dr. Al-Jawari is the director of Blood and Marrow Transplant Survivorship Program, the associate director of the Cancer Outcomes Research and Education Program, and the director of Digital Health at Massachusetts General Hospital. Our next speaker is Dr. Stacy Arnold, and she will address best practices and interventions from the pediatric perspective. And Dr. Arnold is the Associate Professor of Pediatrics at Emory University School of Medicine. Dr. Arnold is also the Program Medical Director of General Hematology and Director of the Comprehensive Bone Marrow Failure Clinic at the Aflac Cancer and Blood Disorders Center of Children's Healthcare of Atlanta and Emory University. We have a lot of expertise in that space to share with you today. And then following our 3 clinicians, we will then hear personal stories of the challenges and triumphs associated with hematopoietic stem cell transplant and its profound effects on one's life and the lives of those they love. We are fortunate today to be joined by Suzanne McCarroll, who will share her experience as a patient, and Margaret Jurako, who will give her perspective as a caregiver. You can find the bios for all of our speakers on the workshop website. And following the presentations, I will join the speakers in a panel discussion. We will welcome your involvement in the workshop today. So please use the box below the video on our website to ask questions of this panel. Thank you for joining us today. And let's begin now with our first speaker.